Am I overreacting for wanting to cut contact with my mom after this conversation about my upcoming brain surgery? I am posting this because I feel insane and need some reassurance. It is a long story, TLDR at the bottom. For some background, my mom and I have had an unstable and unhealthy relationship for as long as I can remember. She has untreated borderline personality disorder, and my family low-key enables her due to her violent outbursts. My mom and my dad were not good parents. I have a lot of trauma. I'm male 23 now though, and I got out. I live halfway across the country with the love of my life. I am in therapy, treating my chronic illnesses, and finally on testosterone after living with an unaccepting family. This becomes relevant later. Last summer, I finally told my physician about my neurological symptoms, and he ordered MRIs. I was diagnosed with Chiari malformation, a congenital defect in which the lower part of the brain cerebellar tonsils pushes into the spinal canal. My herniation is substantial 1.4 km and was left untreated for a long time, which caused hydrocephalus buildup of cerebral spinal fluid in the brain and a syrinx fluid-filled cyst in the spinal cord. These things are treated surgically, so I had to get with a neurosurgeon. He told me I will be needing a posterior fossa decompression, C1 laminectomy and duroplasty. It is a mouthful, in simple terms. This means my surgeon cuts a chunk off the back of my skull, as well as a piece of my upper spine. Then he will place duroplasty, a stretchy patch that mimics my brain's natural covering. These things should make more room for my brain, improve cerebral spinal fluid flow, and reduce the size of my syrinx. What sucks though is that the hydrocephalus is seriously messing with the pressure in my head. It is causing disabling and worsening symptoms, impacting my college coursework and keeping me housebound most days. So, my surgeon may need to perform a separate surgery to install a shunt to drain extra cerebral spinal fluid. I am not sure which will come first yet. They are both major surgeries, and I will have to stay in the hospital. I reconvene with my neurosurgeon this Monday 4/20, and will be scheduling one of the surgeries within the next couple weeks. I only got this diagnosis in September 2025, so this is a very rapid progression and a lot to cope with. I am insecure of my appearance already. I am very modest, and I do not enjoy attention. Now I am gonna have these big scars, and missing chunks of my hair, which has not been this long since middle school. It is going to be painful, physically and mentally. I am very scared for these surgeries. Anyone would be, I would say. When I first got the diagnosis and referral to neurosurgery, I texted my whole family in a frenzy. I was so scared. Since I live so far away, my mom was trying to convince me to come there to do the surgery. This quite literally would not be feasible. Not just because of travel, but also because they have no spare bedroom, they have lots of pets that I am allergic to, and TBH I cannot heal from a brain surgery in the house I got traumatized in. I would rather heal in the comfort of my own home where all my stuff is at, so I refused. I told her she is more than welcome to come visit me, but I won't be going there for the procedure. She was not happy, and got obsessed with the idea of me coming there for months. She eventually gave up after I was firm and stopped engaging. After I had my initial consult last month, my mom expressed wanting to come visit me during my recovery instead of me going to her, which I obviously was not opposed to. When we discussed this initially, she was asking me to shave my face before the surgery since she and my dad do not accept me being on hormones. I told her no, I am not transitioning to comfort them while healing from brain surgery in my house that I pay rent to live in. Either come or do not. She dropped it at this point. For the next month everything was fine. I kept everybody updated on my condition because I am worsening and had to go to the emergency room. My entire family knows I am in bad shape. Even if they are far away, I have made it clear I am fed up with this pain and really need these procedures. I told them I am taking the earliest date and earliest time my surgeon offers, and my family was on board. For a month, my mom seemed empathetic and did not downplay my pain. She stayed optimistic about my appointment on Monday. That changed today. The attached texts are from this morning. After making small talk about the family, she drops this lore bomb on me that she's going on vacation in 2 weeks to celebrate their wedding anniversary and her birthday. She says that she does not want me to schedule the surgery on the dates of her vacation or on her birthday. The issue is that it is highly likely my surgery will fall on one of those dates. She knows I plan to schedule it ASAP, but has the nerve to ask me to wait until they get back. I was already irritated, but then she brought up shaving the facial hair again, so I snapped at her and have not replied since. The final thing that she sent me was really hurtful, because I am not choosing to be alone. She's choosing to book a vacation when she knows I am probably going to have surgery on those dates. I just feel stunned that she even had the audacity to book a vacation and expect me to schedule my brain surgery around it. What am I supposed to say to my surgeon? Sorry doc, I gotta wait.